Yeah, this is still Signature Morning on Signature TV. I always make well to remind us to follow us on all our social media handles. Follow us at Signature TV Officials on Instagram, TikTok, and Facebook. And yes, we are live on YouTube 24 hours. So go subscribe to our YouTube channel at Signature TV. We're switching guests now to, but on same topic, talking about the preparedness of our health sector in regards to this monkeypox and any other disease that may break out, because I know some time ago we didn't hear of that, but now it's upon us. To do that effectively with us, we have Dr. Jeff Okorie. You're welcome, sir.
Thank you.
Dr. Jeff is a chief consultant, I think, with Enugu, no, I don't think, with Enugu State University Teaching Hospital, consultant infectious disease physician. You're welcome, sir.
Thank you.
So we had an earlier guest and we're dealing on this monkeypox. Moving further, we're asking, what are the long-term strategies for preventing the spread of monkeypox and other zoonotic diseases?
Let me start by saying that monkeypox, Mpox, now more appropriately described, is one of those re-emerging diseases, right? And when we say re-emerging diseases, we're talking about diseases that were restricted to a location, or diseases that had occurred in the past and that are now rising to become of public health importance. And we're having more of it. We had Corona and then we had COVID-19. I'll come to what you asked. Now, it's important to note that some of these diseases are beginning to re-emerge again because of globalization. Okay, more trips are occurring, people are traveling, it's becoming easier to move from one location to another. People are migrating out of Africa, moving to Europe, North America, and the rest. So what it means is that some of the things or disease conditions that had been localized to West and Central Africa are beginning to find, a place in Europe and America. So when you talk about long-term prevention strategies, you would need to look at it from a global scale. And there is a concept that is being used right now that is called the One Health concept. One Health concept is a concept that looks at the health of man, particularly as it has to do with some of these epidemic diseases, that looks at the relationship between man, animals in their natural habitat. So that's the One Health concept. So if you're talking about long-term prevention strategies, you're looking at, how to harmonize the coexistence of man, animals in their natural habitat. What that means is that the relationship between man and animals, I give you an instance, there is a lot of deforestation going on, right? Man is invading what is the natural habitat of these animals, from where some of these zoonotic diseases are picked up from. So, these are things that have to be looked into, because man is going into the forest, there is agriculture going on, there is industrialization going on. So looking at it holistically, it is the One Health concept. How does man prevent himself in the course of going about his daily activities from picking up diseases that are domiciled in animals naturally? And then how does the environment help us? A lot of people are moving from rural communities into the cities. We have hunger in the land. Everybody knows what is going on right now. People are moving into the forest, and then people are eating all manner of things. And then with low socioeconomic class, with man getting involved with forestation, deforestation, with increased migration, all of these, when they are not synchronized, put man at risk of picking up diseases, not just Mpox like we're discussing. This is Mpox, but Mpox is just one. Yellow fever is there, is the same. So these are all zoonotic conditions. So going forward, it is the platform of the One Health concept that protects man in the course of his activity, in the course of interaction with his environment and animals, to be in a place where he's protected from diseases that would affect him in the course of his daily life.
All right. I mean, this is quite interesting because I'm trying to find out. This is coming from Congo. Well, I understand that
Yeah.
it was first discovered in 1957, 1958 or so.
58.
58. How did this particular one break out?
Nobody can say exactly this is how it broke out, but we know that Mpox is a disease that you find in rodents, find in primates, find in squirrels. And like I said, the moment there is interaction between man and these animals, you may not be able to say this is what happened, but it is in the course of interaction of man with these animals. And when I mean interaction, interaction could come as man, humans getting involved with catching these animals. And then they come into raw contact with the monkeys or the squirrels or infected body fluids from these animals. We're talking about fecal matter here, we're talking about urine, we're talking about saliva or other body fluids from these animals. And then interestingly, man feed on these animals. And sometimes these animals are poorly prepared, poorly cooked. I remember having had to manage a case, I think that was in 2019. And then, the guy traveled to Bayelsa and then he was feeding on bushmeat. And then he wasn't home prepared. So he got it by the, by the roadside. And then he came back home, had the symptoms presented, and lo, it was monkeypox.
Wow. Wow. So how is the health sector in Nigeria prepared for this? Because again, some people will say we really never prepare for so many things. If for anything, I mean, the COVID-19 would have taught us a lesson. Have we learned a thing or two from it? Are we preparing for it? We understand that even vaccines are being imported. Congo is reporting that they have received vaccine from the USA. They will soon receive vaccines from the USA and Europe. And that means the vaccine is not even ready, as the case may be. How is the health sector in Nigeria preparing for it? Do you think that we should start as a continent and then Nigeria look inwards to homegrown solutions to some of these diseases?
Absolutely. Preparedness for epidemic diseases is something that's been on the front burner, especially after the advent of COVID-19. COVID-19 took the world at large, hit the world below the belt, and then we found out that even the supposed developed countries were grappling with the numbers that they were having, but for some reasons, the wave in Africa wasn't as predicted. If the wave in Africa, if it hit Africa the way it hit Europe and America, it would have been dead bodies by the streets. So that tells you that our health infrastructure is suboptimal, and it's no news. It's in the public domain. Now, what I would say is that COVID kind of alerted us in sub-Saharan Africa as to how weak our health infrastructure has been. A lot of states didn't have isolation centers at the time. They didn't even have infection prevention protocol in most hospitals. Most people didn't even know about infection prevention protocol. So all of these were the gains of COVID-19. Are we prepared for what is coming? I don't think we are. But what I think is that we can leverage on the gains of COVID-19, because whether we have gains from COVID-19, we surely do. Because I can tell you that we are now aware that a number of hospitals, don't ask me how prepared those isolation centers are, but a number of hospitals now have isolation centers. Are they enough? Obviously, in my assessment, they are not adequate. But at least we have something, as opposed to 2020, when there was next to nothing. So what I think is that the government would be working on improving the facilities of the gains of COVID-19 and then getting ready for what could come with Mpox. And when we talk about health infrastructure, we're talking about humans, we're talking about materials, right? We're talking about human beings that are trained to handle. It's not infectious diseases of high consequences, not something, not even every health professional can manage. All right. So that's why we have infectious disease physicians, being trained across the country. And then even if you are not an infectious disease physician, there is a protocol. I can reliably inform you that there was a meeting last week of all the health state commissioners of health across the nation in Abuja with NCDC. And then that is like a larger group of trying to brainstorm on how to take on the challenge of Mpox, you know, as it comes. And part of the outcome of that meeting is that they are supposed to come down to the state and step down the knowledge of what is discussed, and then the strategies on how to contain this disease as it comes down to the state, and then from the state to the local government and to the communities. Because if you just say, you know, let everybody know, it is something that the state has to respond, all right? The state has to own it and then take leadership in the response, okay? And that is what I expect from what is going on at the Federal Ministry of Health, step down to the State Ministry of Health, down to local government and communities. It will involve mobilization of manpower. It will involve a lot of human capacity training so that there is preparedness, so that people get to know what to do. Because I can tell you, in most facilities, you get there and then you say monkeypox, everybody jumps through the window, including the health care workers, because they don't know what to do. So people should be trained. There is a lot of training and retraining that needs to be done. And then very importantly, you know, it has to, the health infrastructure, the isolation centers, the PPEs. PPE is personal protective equipment that is supposed to be a shield for the person who is practicing, so that in the course of taking care of somebody, you don't put your life on the line.
Okay, so how effective is the current communication strategy informing the public about monkeypox with the prevention and the control measures?
Yeah, it's how effective. What I would say is that a lot needs to be done, right? You find people getting information online, reading stuff on the news. But the truth of the matter is that when you get to the rural communities and you say Mpox, most people don't even know what you're talking about. So the communication needs to step down to the rural communities. And, you know, unfortunately, a number of these things go on there because they are the ones who are engaging more contact with the animals, you know, more contact with the forest. So I think that part of the response would have to be communication. I don't think the communication is optimal. I think that more work needs to be done in enlightening the public on the symptoms of this disease, being able to be aware of what is going on and how exactly to respond, just in case anybody sees something that he or she suspects to, that could be Mpox.
Okay, you know, most times we get these things hit us like we're not aware. So my question will be, what role do vaccination campaigns play in the preparedness plan, and how accessible are vaccines to the public?
Okay, here again, just like most other things we do, in times like this, we don't own these things as a nation. It's not peculiar to Nigeria, right? It is a third world country's problem. These vaccines are not produced in this country. We would need to depend on USA, you know, Europe, and a lot of donor agencies, and then, you know, funder agencies to be able to embark on these things. As I speak with you, the information I have is that there are about half a million vaccines available, all right? And then about 2-point-something million will be ready by the end of the year. These are what the statistics look like, all right? So, and then, of course, you know that the global attention is on DR Congo. That's where most of the vaccines would be sent to when it arrives, all right? And then the next in focus is Nigeria because of our large population. So it becomes important that going forward, I cannot tell you that Nigeria will wake up and start producing vaccines today, okay? I mean, it is what it is. We would still have to depend on support from the developed nations to help us combat this condition. And then I know that when the vaccines are ready, it will still cascade down from the Federal Ministry of Health down to the states and to the local governments. In that order, that's the way it has always been.
Wow. Dr. Jeff Okorie, wow, what a time with you. A consultant, infectious disease physician, Enugu State University Teaching Hospital. Many thanks for your time. We'll keep engaging these issues because I also think that developing homegrown solutions to our problems is a way forward. Waiting and depending on foreigners because we feel that they are superior is for me not something I think that we should continue doing. Just like we did with COVID. We had to wait it all out. And even when it felt like we're producing our own, some of us killed it and said we shouldn't take it because we're not sure. So if they can steal our knowledge, steal our doctors,
Steal our oil.
and steal so why can't we develop ours, to cater to some of these issues?
Yes.
So we'll keep engaging these issues and with the view of finding the solutions to some of these things. Thank you again for coming.
It's my pleasure being here. Thank you.
All right. So coming up all the way from Abuja is a very, very interesting package report. My colleague spoke to you earlier about the world's mosquito. World Mosquito Day.
Yeah.
When you mention mosquito, the first thing that comes to my mind is malaria. Because